In this chapter, we provide brief guidance about how to use ethics to guide early years activities and how best to evaluate new, innovative interventions. So far, the information in this resource is based on the best quality evidence about the effectiveness of interventions to support parents, their infants, and children in the early years. However, we do not always have the luxury of having such evidence. In cases where we don't have the evidence but nonetheless need to take action, one approach is to draw on ethical principles to guide our decisions and actions. Many of these are self-explanatory. The 10 ethical principles are: do good, do not harm; equity. This may focus on reach, access, and involve a need to target specific populations. Respect, empowerment, supporting others to have more control over their health. Sustainability, making sure activity is as long-term as it needs to be. Social responsibility, protecting the interests of the clients at all times. Participation, ensuring the involvement of the clients in shaping activities and consultation. Openness, being transparent, and accountability. We can use these ethical principles to ensure that the activities we propose are as ethically sound as possible. Decisions should be made taking an overview across all the ethical principles. It is equally important to evaluate new interventions so we can judge their value for future actions. Policymakers need to know what works, for whom, and in what contexts. Practitioners on the ground want to know how to do things better. Funders need to know whether they should continue to pay for it, and so on. For these reasons, evaluation needs to be part and parcel of every new intervention. For evaluation to be useful, it needs to be part of the planning and delivery of any new activity or intervention. This ensures that local learning can be captured over time. Gather baseline information. This allows us to compare how things were before the intervention began with how they are since the start of the intervention and in the longer term. Gather appropriate information to measure clear outcomes. This allows us to see whether an intervention has made a real difference in terms of outcomes that we can measure. For example, families get high-quality support they need when they need it, rather than simply describing the experiences of those involved. Planning an evaluation is a detailed process and varies depending on what exactly you want to evaluate. More detailed information is available in the Early Years Task Force paper. There are also comprehensive guidelines on how to plan and conduct an evaluation at the following websites: NHS Health Scotland, Evaluation Support Scotland, Better Evaluation, and the National Institute of General Medical Sciences. If you are specifically planning an economic evaluation, NHS Health Scotland has a specialist financial evaluation document. Links to all of these websites can be found in the Early Years Task Force paper.